To recap where we've been looking more deeply into what are mood disorders and anxiety and how do you actually come up with a diagnosis. So now I'd like to ask, once a diagnosis is made, what kind of help is available?
And so the diagnosis is really very important, and we think that many of the common illnesses that could benefit from psychiatric care, such as depression, often go undiagnosed for years at a time. But once a diagnosis is made, there's actually a range of treatment options available. These include medications, so-called antidepressant medications, which are effective in 40 to 50% of people with depression. But we also have a range of talk therapies or psychotherapies that are available for treating depression, and which can be quite effective, particularly for less severe forms of the illness. In the case of anxiety disorders, there's a similar range of options, but many kinds of specific anxiety disorders, such as phobias, benefit enormously from what's known as cognitive behavioral therapy, where a psychologist or a psychiatrist will help the patient focus on situations that are particularly threatening or which tend to provoke anxiety symptoms and learn how to overcome those symptoms through gradual exposure. In situations where the anxiety symptoms are too great or where behavioral treatments alone are insufficient, anti-anxiety medications can be used. It turns out that many of the same medications that are used to treat depression also work well for anxiety, and there are also specific anti-anxiety medications that can be used primarily in the short term to control anxiety symptoms while behavioral therapies are implemented.